here in Acadiana is
Ollie Bear.
All right, a new year, the new you. Al, Dr. Jon Liprie, and they've got a few ideas on how to put the two together and make us all what we can be.
Oh, but they do. Let's just send it right to them. Guys, good morning.
Hey guys, we are back. Dr. Jon Liprie. We're at Parish Biscuit Company. New year, new you.
New year.
And we've been talking about a lot of health issues that people need to be aware of. Let's talk a little bit about mental health.
Yeah, that's a big deal. I'm glad we're able to cover more mental health stories. You don't normally see that in the news.
Yeah, you don't. And there was a time when it was sort of an issue you didn't touch,
Right.
highly sensitive. People didn't want to talk about it.
Right.
But now people are open about it.
Really glad.
You know, and of course I think that's the big thing is there's really no stigma.
No. And 1 in 5 have mental health issues. 1 in 20 have serious mental health issues. That's defined as an issue so bad it interferes with work or daily living.
So I guess for me, I'm thinking if there's a member of my family with a mental health issue, the family members need to take some role in getting this dealt with. Is that?
Yeah, absolutely. Denial is a big deal in the patient, in the person. But your friends and loved ones know. They're the ones coming to me going, hey, look, there's a real problem.
Yeah.
Here. And remember, about 10 to 20% of these guys also have substance abuse problems,
Right.
alcohol and drug abuse. And that's generally what brings them in.
By trade, I'm a healthcare writer and reporter. For years, I did medical projects primarily about mental health issues. And one of the things I found is a lot of homeless people they kind of develop schizophrenia, and then they self-medicate to get rid of the voices and all of that, and then
street drugs.
right,
Yeah.
and then it just boom, boom, boom. It just kind of all piles on.
It's really hard to detox someone, dig through the layers, and get to their mental health issues. And those are still spending time inpatient psychiatric facilities to tease through that.
So, how do family members deal with this?
Well, what I see as an inpatient physician is something breaks, they bring them into the ER, and now we have them.
Okay.
But ideally, you deal with this issue before something breaks, right? And that's counseling, and there's really effective, safe medication paired with counseling. It does a great job.
Yeah, you know, medication is so much better now than it used to be.
Oh, very much.
And I know that a lot of medicines that they give for schizophrenia now don't have the side effects they used to have. Patients are more likely to stay on the medication than they used to. So, you know, and look, if someone in your family has an issue, talk to somebody, some help. Call Dr. Liprie. He's here all the time. Not a Parish Biscuit Company, of course. Hey, we're going to go back to you in the studio. More Good Day, Acadiana.